And so hi everyone, welcome to this evening's video on Discharge Summary. We've fortunately got Lily, who's an F1 at Wythenshawe, who's going to be giving this teaching session this evening. Just as a quick overview of what this is going to be about. So as the title might be a bit of a giveaway, it's mainly administrative, but these things should never be overlooked in medicine. Particularly with discharge summaries, because a patient's care doesn't end once a patient leaves hospital. And Lily will explain why and show us how to make sure we've got a good continuity of care. So over to you, Lily.
Cool. So as Steve said, I'm going to be going over the discharge summary today. So it's a very common FY1 task, and not just FY1, but as a junior doctor, you'll be doing this all the time. So I think it'd be useful to familiarise yourself with how to do it. Like Steve already kind of mentioned, we've got to aim for people to be discharged safely. In particular, it really helps the GP to know about their stay in hospital. And it's helpful to other doctors on future visits. You'll find yourself, if you're seeing a patient for the first time, having a look back and having a read through what previous people have written. So it's really useful. And yeah, it is potentially quite dry, but it's really important. So just briefly, this terrible graphics, but at Wythenshawe, we use something called Jack, and wherever you are, there'll be probably a similar system. An online system for doing writing your discharge summaries. This is just a picture I took just to give you an idea of what kind of looks like, the structure of it. It's quite helpful. It'll show you different sections to write in, so it gives you a bit of structure. You're not having to come up with all of it off the top of your head. So first thing to check, systems will usually do this all for you, but it's always good to check that you've got the right patient. So patient's details, name, date of birth, all of this should be included. And again, should be done for you, but it's important to check the GP's name, and so you're checking that it's going to the right person, so the GP can sort of see and make sure patients are followed up properly. And you'll always have on there which hospital or which sort of place they've been discharged from, which consultant they've been under, and which who's discharged them, and the sort of department that they've come from. And yeah, it's always good to put when they were admitted and when they were discharged. So the first section that you'll have seen there. So again, I was just going to say, everybody writes these totally differently. You'll read different people's and they structure it really differently, but I'm sort of going over how I do it. Everyone thinks theirs is the best way. So I normally start with a brief history. So when, this person came on this date, and do a brief history of what they presented with. So for example, sort of cardiology related, you might have somebody that's presented with chest pain, and you can put details of how long they had it for, any other symptoms that they had. And yeah, don't need to go into absolute detail, but the key sort of points that you think would be important for someone to know. And in this section, I always put a little brief past medical history, just to contextualize it all a little bit. And I always find you see so many patients, it sort of helps you to be reminded about what the person came in with and sort of the scenario. The next section is key investigations. Sometimes you might not have a lot to put in this, but if you sort of think about what the person's come in with, so you don't need to put every single blood test result, but it's important to put the key ones. Again, most people have an ECG. It's not always relevant. Oh, sorry. But if somebody's come in with a cardiac problem, it's quite good to write. I find the sort of initial ECG findings, and yeah, a troponin, for example, might be relevant. Again, if you just think of somebody reading this, what would I want to know? And it's quite good for sort of future if you have details like this. And yeah, other tests they've had, you can mention. Not people won't always have access to these results, so you can write what their chest x-ray was. It's good to put details of an echo. And yeah, if you're waiting for any results, that's important as well. Yes. Next section is procedures. So in this section, I'll put any procedure they've had, what date they had it, and then I normally will put sort of a few bullet points about how it went, what it showed. So for example, if patients had PCI, you put what date it was, and I normally just have a read of the report and put the key points. And yeah, if you're on a surgical job, it's good to put any surgeries they've had, and yeah, the success of the surgery. This bit's kind of general. This is the bit where I kind of write how they've progressed basically throughout their stay. So you can briefly mention how they were when they came in. I normally will mention, key things again here, and I've put more detail in the other sections, but, did they have a procedure? What medication that we've given them? And I think you think that you don't want to waffle and give too much information, but particularly things with drug management, I've found recently, if you've given them things like antibiotics, it's really helpful if you put what they've had and for how long, just for people to refer back to, because you can't always have access to that information. And yeah, how they responded, anything else we've done for them really, and sort of what state they were in when they left us. Follow-up, really important. You put details of any follow-up they're going to have, any follow-up investigations, any follow-up in clinic, depending on where you are. Sometimes by you're just writing follow-up in this clinic, the ward clerk will very kindly magically make it happen. Sometimes you do have to arrange it yourself, so it's always good to familiarize with different things. Sometimes you have to email a clinic or a secretary to get someone booked in. But yeah, so details of any investigations. So if they're going to have an echo in X weeks, if they're going to have a cardiac MRI scan, if they're going to have a repeat scope. I'm on gastro at the moment, so writing a lot of those. Yeah, and then like I said, any follow-up. So follow up with this consultant in this many weeks, and sometimes you might put things like needs a DN, needs district nurse referral, things like that. So any follow-up they're going to have. Yeah. So the medication changes section, I think I've changed how I do this over time. We have amazing pharmacists who will, check everything for you. And sometimes I would check back on their things, and they always do this sort of structure, which I find quite helpful now as well. So you can write a little heading saying medications changed. So for this example, say somebody came in on a torvastatin, and we've increased it to 80 if they've had a cardiac event. So for example, and then you can write something like medication started. So anything new that we've added. So yeah, there's an example there. So this just really helps the GP and anyone else that it might be relevant to see exactly, because they're going to be sort of making changes to the patient's regular medications. So medication started, and then any medications that we might have stopped. So like I said, this just helps somebody to knock things off people's repeat meds and add things on. And yeah, particularly when I was on surgery, things like analgesia, it's really helpful to write a little pain plan. So you don't want to be sending people home with just a stack of opioids. So it's sometimes quite useful if you're prescribing a few different things to write how you expect them to progress over the next week, say. So that just helps them to know what they should be taking. Actions for GP, sometimes there's nothing, but this is really important if there's anything at all that you want the GP to do. So for example here, if you're starting them on a new medication that requires monitoring, if you're starting them on diuretics, ACE inhibitors, things like that, it's important to write a little note to say, do you mind checking this person's bloods in this, like in 2 weeks? Things like if people have come in with bleeding and you'd like their HB checking in a little bit, that's really important. And sometimes if you just want somebody to sort of check in with the patient, it's important to put it in here. And yeah, if you can just be as explicit as possible, the GP, I'm sure, would thank you for it. Yeah, and then there's a little section called information to the patient. I know people who don't write anything here at all, because often the patient will be given a copy of this whole thing. But I normally write a few sentences. I think it would be sort of summarize basically what the patient needs to know. So I'll normally be like, you were admitted, this is what we've done, this is the diagnosis we've given you. And I'll normally mention again, like, you'll have follow-up with this person in however long. And I normally do a little sentence as well of safety netting, just a little like line saying, if you experience worsening of your symptoms or if you experience XYZ, please come back. They honestly might not ever read this, but I think it's quite nice to include, personally. And yeah, this should again automatically be on there, but when you're finishing, you can just make sure that it's got all your details on properly. These are other sections that are on there, which often aren't, you don't have anything to say. But for example, if you did have somebody with social issues, if you've got like a social, any social concerns, or if any sort of social support has been set up, you could put a little bit of detail about that here. So the last bit, or some people do this first, some people do it last. So the TTO part. So when you discharge someone, you've got to put all their medications on. Again, the pharmacists are really good and they will check it all for you and call you out if you do things wrong. But yeah, so first thing to check is make sure they've not got any allergies. Most of these programs, they'll make you, check and state that they've got no allergies before you start prescribing things. But yeah, it's always important to do. And then, yeah, you put on every medication that the patient is currently taking. So that's regular ones, PRM ones, and sometimes acute ones. If you're sending someone home with antibiotics, you'll only give them a certain amount. So yeah, this will all be on there. But so the name, there's often loads of different forms of things. So you make sure that pick the right one. You want like a tablet rather than a liquid or something like that. What route you want it taking, and the frequency. So some things, the frequency is quite set, but other things, you will be required to change how often you want them to be taking it. And yeah, duration of the treatment. So how many days you'd like them to take it. And yeah, it's good to put additional notes on certain things. So if you only want somebody on something for a few months, you can put a little note saying, can you review this at this date? Like I sort of mentioned before about monitoring requirements, if anything needs checking, any bloods or anything. And things like steroids, it normally will automatically put a note on in just like details about how to take it and things to look out for, really. Sort of sped through that, but has anybody got any questions about what we've talked about? Sorry, I speak quite fast.
No, I think that was fantastic, Lily. Thank you very much. I think the only comment I would make from my own experience is that you'll just reiterate what you mentioned earlier when you said, what would I want to know? Because there's so many times that I've seen discharge summaries when patients are coming back into hospital and you do have limited information, that might be your only source of information. And so it's really useful to have quite a comprehensive sort of roundup of sort of why the patient was last in hospital. But similarly, I think sometimes people might take that a little bit too far, and copy and paste every single blood result, every single image report that might not necessarily be helpful. So I think it does become a skill, but naturally I think what you've said should stick in your minds is the take-home message is what would I want to know?
Yep.
No, so thank you very much.
You're welcome.